Hey guys, today we're going to be talking about the brachial plexus. The brachial plexus can be kind of complex at first, but once you get it down, it's pretty easy to remember. The brachial plexus is a bundle of nerves that come in and out of one another, and some nerves branch off. It's kind of like a network of nerves. The brachial plexus originates between the anterior and middle scalene muscles in the neck, so that plexus passes through those muscles. And the brachial plexus comes down into the axilla or armpit, and then down the arm, forearm, and into the hand. The brachial plexus is important to understand clinically. So if a patient comes into the clinic and reports that they have something wrong with their hand or their forearm, or something feels weird, it could be originating in the brachial plexus in the neck rather than down into the hand. But this takes some deep understanding in order to diagnose. So for example, one of the clinical applications is if there is a bunch of numbness in the arm, forearm, and hand, it could be indicative that those scalene muscles, the anterior and middle scalene muscles, are pinching on the brachial plexus and causing some discomfort. I will mention some clinical applications later in the video. It is also to note that this brachial plexus drawing is pretty classic in textbooks. However, each individual is typically slightly different. So if you find yourself dissecting a cadaver and notice that a nerve may not be coming off where the textbook says it should be coming off, that's pretty normal. I will mention a couple of the variations in this video, but just note that this is a general guideline and what's most common. So firstly, let's start off with the divisions of the brachial plexus. The brachial plexus is divided into roots, trunks, divisions, cords, and branches. So starting off with the roots are C5 to T1 spinal nerves. This is the ventral rami of spinal nerves. So these are the roots. Some of these roots are going to come together to form trunks. So C5 and C6 come together to form the superior or upper trunk. C7 stays on its own with the middle trunk. And then C8 and T1 come together, those roots come together to form the lower or inferior trunk. So let's talk about a couple of nerves that are coming from these roots and trunks. So firstly, looking at root C5. So C5 is going to branch off into the dorsal scapular nerve, and oftentimes it does receive contributions from C4 root, but that's not in the brachial plexus. So the dorsal scapular nerve is going to innervate the rhomboid muscles on the back, medial to the scapula, as well as the levator scapulae muscle, superior to the scapula. So this dorsal scapular nerve have the roots C4 to C5. Like so. Also coming off of root C5 is the phrenic nerve. The phrenic nerve also receives contributions from nerves C3 and C4. So C3, 4, and 5 keep the diaphragm alive, so that is the phrenic nerve. And the phrenic nerve innervates the diaphragm to allow us to breathe. Also coming off of some of the roots, I'll do in a different color to make it easy, is the long thoracic nerve coming off of root C5, C6, and C7 is the long thoracic nerve. The long thoracic nerve innervates the serratus anterior muscle. Coming off of the superior trunk, we have the suprascapular nerve. So the suprascapular nerve comes from root C5 and C6 off of that superior trunk. And this nerve innervates the supraspinatus and infraspinatus muscles, which are a part of the rotator cuff muscles. Nerves to those scalene muscles, the anterior, middle, and posterior scalenes, are gonna come from C5 to C8. I'm not gonna draw them for sake of trying to keep it slightly appealing to look at, but those nerves do come from C5 to C8. So now let's look at the divisions. So firstly, we will do the anterior divisions. I'm going to do an orange, try to make that neat there. So both the superior and middle trunks have an anterior division that come together, whereas this inferior trunk does have an anterior division, but it just stays on its own. if you were looking in a cadaver, these divisions would be more anterior on the body. There is a posterior division for each of these trunks, which I'll do in blue. So the superior trunk gives off a posterior division, middle trunk posterior division, and that inferior trunk as a posterior division. So each trunk, superior, middle, inferior, gives off both an anterior and posterior division. It's just which ones are combining. It's just this anterior divisions that are slightly separate. Once these divisions come together, we're then going to be forming these chords. So we have a lateral chord, posterior chord, and a medial chord. Lateral chord, posterior chord, and a medial chord. This is where things start to get a little bit interesting and we have more going on. Off of this lateral chord, we have the lateral pectoral nerve. The lateral pectoral nerve comes from C5, 6, and 7. The lateral pectoral nerve innervates the pectoralis major muscle, only part of that pectoralis major muscle, whereas the medial pectoral nerve is going to innervate both the pectoralis major and pectoralis minor muscles. Off of the posterior cord, we have 3 nerves coming off. We have 3 subscapular nerves. We have an upper, a middle, and a lower subscapular nerve. So the first one is the upper, the second one is the middle, and the third one is the lower. The middle subscapular nerve is also known as the thoracodorsal nerve. The thoracodorsal nerve innervates the latissimus dorsi muscle. The upper and lower subscapular nerves are going to innervate both the teres major muscle and the subscapularis muscle. The subscapularis muscle is innervated by both the upper and the lower subscapular nerves, whereas that teres major is only innervated by the lower subscapular nerve. The origin of these nerves is a little bit weird. Both the upper and lower subscapular nerves are C5 to C6, whereas that thoracodorsal or middle subscapular is C6 to C8. Again, this is sometimes variable. Off of the medial cord, we have again 3 nerves coming off. We have the medial pectoral nerve. We have the medial antebrachial cutaneous nerve going to the skin of the forearm. And we have the medial brachial cutaneous going to the skin of the medial arm. All 3 of these nerves have the root C8 to T1, which makes sense because we have the inferior trunk to the medial cord from C8 to T1. Also, something a little bit interesting is that oftentimes the medial pectoral nerve and lateral pectoral nerve have a connection to one another. So it would look something like this. And this is called the ansa pectoralis. The ansa pectoralis allows each of these nerves to communicate with one another since they are going to similar muscles. Again, the lateral pectoral nerve is going to go to pectoralis major. The medial pectoral nerve goes to both pectoralis major and minor. So this communication of nerves allows those two muscles to communicate with one another and allow for the contraction of those muscles in a fluid manner. Lastly, we have branches. For the branches, the posterior cord is going to branch into 2 nerves, whereas the lateral and medial cords are going to come together. Like so. So the lateral and medial cords come together to form 3 branches, 3 different nerves, and this is going to be more anterior to this posterior cord branching into 2 different nerves. So the lateral and medial cord are going to give off the ulnar nerve, median nerve, and the musculocutaneous nerve more laterally. The posterior branches are the radial nerve and axillary nerve. So let's talk about the roots of these nerves. Musculocutaneous comes from C5, 6, and 7. Median nerve comes from all of the roots, C5 to T1. And the ulnar nerve is only C8 to T1. Again, some of these are variable depending on the source that you're looking at. And then the axillary nerve is C5, C6. And radial nerve is again all of the roots. So talking about what these nerves are going to innervate. Musculocutaneous nerve innervates the anterior arm muscles. The axillary nerve only innervates two muscles. That is the deltoid and the teres minor muscle, part of the rotator cuff muscles. The median nerve is going to innervate some of the anterior forearm muscles on the lateral side, whereas the ulnar nerve innervates anterior forearm muscles on the medial side. Both the median and ulnar nerves are going to innervate the palmar muscles as well in the hand, palmar muscles in the hand. And the radial nerve innervates all of the posterior side of the upper limb. So posterior arm, posterior forearm, and the posterior hand, all innervated by the radial nerve. When I was working on my master's, I did cadaveric research on anatomical variations within the brachial plexus. And one variation that I found pretty frequently was this middle subscapular nerve. Instead of coming off that posterior cord, very frequently it would actually come off of the axillary. So that was one of the more common variations that I found within the brachial plexus. So in terms of clinical applications and ways to think through this so that you can really evaluate how well you know this brachial plexus is think about what would happen if the medial cord became damaged. There was some sort of injury to the medial cord. Well, in order to answer that question, you would have to be comfortable with the nerves that are affected as well as what muscles those nerves innervate. So for example, medial cord, the medial pectoral nerve goes to both pectoralis major and minor. There would potentially be some issues with flexion, medial rotation, or adduction of the arm. Also would very likely experience some tingling sensations along the arm and forearm since those cutaneous nerves going to the skin could be damaged. So that's just an example of how you should be thinking about the brachial plexus so that you can apply it to real world scenarios. I hope that this helped you, and please leave a like and subscribe if it did so that you can be notified for future anatomy videos. Catch you later.